This is us. We are number one. Probably have the most wins in GEMS history.
That's some spies behind us here.
So,
that you can't see behind the camera, but that's okay.
I don't care where you're from, especially from Boca Raton, Florida.
Okay, the team you're going to see next is Fire Department of New York EMS. It's a team that's been with us before. I'm A.J. Heitman. I'm the editor-in-chief of GEMS, actively involved with the GEMS games, and with me today is Chris Brainerd.
I'm a retired deputy chief with City of San Diego Fire Rescue and longtime judge for the GEMS games.
And how many years in San Diego Fire before you retired this year?
I thought you weren't going to ask that.
Oh, come on.
33 years.
33 years. That's a long time. So let's get forward here and take a look at FDNY EMS.
Okay, now he's jumped into another vehicle.
Okay.
All right, they're closing in. Looks like they've...
This is the first thing that they see is a darkened stage that lights. You see a helicopter with some smoke coming from it, a lot of debris, and then they are actually kept back from the scene while they check in with the incident commander at the remote incident command post.
Now, the team that we're going to see here is FDNY EMS, and they've been in the competition probably for all 12 of the years, and they come, and it always hasn't been the same team, but they always react the same way, and they often are very involved together throughout the year in training, and they practice at their SEM center, and I think that we've seen, particularly with this team and many others that come back year after year, that really helps them get into the GEMS games.
And they are certainly one of our more animated team. They tend to be louder, which can be a good thing because what's missing here is all the noise, the generators, the distractions that the rescue crews and the overhead helicopters bring. So their loudness is actually a good thing in a real scene. And as you notice, each one of the team members has a backpack. That is the only medical equipment that is made available to them for the entire scenario. Whether it be 3 patients or 12 patients, that's it.
And they're allowed to have 3 packs, but they don't have to all be the same, but they all get checked. They're all examined by our judges before the competition to make sure that all of the required medications are there, expiration dates and everything are on there. So this is truly like a real call. And I think what's significant here is, you have a team leader who is quizzing, asking the firefighters, can I go in? Why can't I go in? Is the scene safe? Will you let me know when?
Sure? Come on, just go like this. Just go like this.
He's actually making fun of our scenario in a polite way, in that he's trying to ask this firefighter politely, hey, help me. You can't help me? Why not? This is ridiculous. You're a firefighter. You should be able to open a simple airway. And the banter goes back and forth a time or two, and quite frankly, as you heard, the crowd likes it. New York is known for being very confrontational in a professional way.
What's that?
And I think the key to any competition, and I've been to competitions in other countries as well, is that you have to have a team that you could separate. You could drop one of those people in, and they can function independently. If you have to rely on the other team members to take care of one particular patient, you're not going to do well in the GEMS games.
And these teams have been sequestered sometimes for hours beforehand, so that there's no possible way, we believe, that they can see any of the set being built or this helicopter being brought in through the backstage door, that they don't get any advance notice, they don't have cell phones, they don't have any communication devices. So when they walk in, they have no idea whether they're going to get a bus crash, a tornado, an assassination, a multi-victim shooting, or helicopter crash. All of those we've done in the past. So all 3 team members, as you point out, AJ, absolutely have to be prepared for any type of patient.
And I think like we saw this year with all of the teams, they bring their training directors with them. They bring their chiefs come to the GEMS games. They want to watch their people who've been practicing for a year perform. And it really is a performance. It's a choreographed performance.
One thing that you noticed was that FDNY quickly addressed the pilot and black tagged him, which means that they found no survivable indications of life. So according to the Heart Association and our multi-patient guidelines, they quickly place a black tag on the patient and they move on. That patient is not salvageable.
And that's important because you have to make a decision when you're overwhelmed by 4, 5, 6 patients that I'm not going to have time to be able to resuscitate. And most people know it's very hard to resuscitate a patient with 000 when they're a trauma code.
One thing you might notice is that you've got paramedics very close to a dangerous scene. that's one of the limitations of our scenario. If this is a true helicopter crash, nobody would be that close to a helicopter that didn't have fire protective clothing on. Again, a limitation. It is what it is. We have to allow some things to progress. Here, the child is presented to the paramedics for the first time at the 4-minute mark. Until this point, the baby was literally under the stage, and one of the judges actually makes the child available. Hopefully it's recognized by a paramedic that it is a patient, and then you can see him going to work.
And what you notice, as we referenced in one of the other scenarios, is the FDNY team brought the baby close to the other adult so that they had a kind of a collection area set up, and it was close for equipment, close for communications, at a high chaotic scene. I think that's a real plus.
We've seen an evolution of that over the years, that the teams are creating an internal casualty collection point where they're bringing the patients together, one, so they can communicate more easily, and then also so that they can share equipment more efficiently. Here, FDNY was the only team this year to bring out an oxygen leader tree, anticipating multiple patients, anticipating an internal casualty collection area, so that they can distribute oxygen from their single bottle to multiple patients. Very smart move on their part.
Yeah, and I think it's the first time that I've really seen that. I've seen a lot of innovative things, like people introducing metronomes and other things at the scene. And you also notice that they all have tape on their belt, they have extra scissors, they have all those kind of things, because when you're on the other side of the stage, you can't rely on somebody bringing you from a scene a pair of scissors. You have to have it.
And what I am impressed more than usual with these teams is how calm they are. Their motions, there's not a lot of wasted effort. They're very efficient. They're able to share equipment. They communicate clearly. There's not extra talk that's not necessary. And it shows their experience, quite frankly.
And I think you learn other things, particularly from the competition, like when there has to be an IV start. Sometimes they'll throw over a whole pack that they have, you know, a tourniquet wrapped around a bag and a catheter and maybe a intraosseous, and so that they're not looking for individual parts. That all takes extra time. And the other nice thing about the JEMS games that we've seen is that not only do they practice all year, but afterwards they go back to their home stations and their home departments, and they critique themselves. And I know in the case of all these teams, they go back to their training academy and they teach the other students errors that they might have made or things that they think that they did that helped them win the competition. And so that's really the benefit for the whole thing. And all of this is taken down on the computer from Laerdal, and I know in particular that you and Chad Mercado, the coordinator, are going to do a follow-up article that talks about some of these things.
Now here we've got the team leader, again encountering a firefighter that resists helping. I know that firefighter is frustrated because even though they're role-playing, they want to help.
They want to help.
They've been told, hold the hose, stand there, hold your radio, but don't help them. And again, that's something we're going to probably take a more critical look at next year on how to involve the resources at scene a little bit more.
And you heard the team leader say, well, come on, you're standing around. You're not doing anything. You can help me do this. And the crowd loves it. The crowd gets into it. But I think everybody in their mind is saying, if I was at the scene, I'd be really yelling at this guy to help me. And we had great support from Maryland Fire Rescue Institute this year. They sent people over with all their gear, and people sometimes don't realize these firefighters are up on that stage for 3 hours with their turnout gear on. We give them a little water. It's almost like punishment, you know. You're up on the stage for 3 hours, but they love doing it, and they love the thrill of the chase.
Some of the debris that you're seeing is stuff that we've, moulaged the stage with. We've got burned clothing. We've got suitcases, pallets. We build all this stuff Friday afternoon in anticipation of creating the most realistic set that we can. Now here, back to the baby, we've got the hoses coming out of the baby's diaper. That's all the electronics hooked up wirelessly so that Laerdal, who's off stage, can capture data for us and then also sequence the baby to do certain things. Stop breathing, lose a pulse, change the pupillary size, and they can also capture what the rescuers do.
And in amongst the debris is some of our equipment and our kits. And I've been on calls where you look around, where'd I leave my stethoscope? God, you open up an intubation start kit or something like that, and you lose it on that debris, and you're in trouble.
Now, FDNY chooses to have just a very small little holster on their hip for pen light and scissors and so forth. Some of the teams like to have a larger toolbox on their hip, and it's just all preference. But they found that this is efficient. Now, this particular case, they've got a bag valve mask on a patient, and they've got a smaller bag, which is more appropriate than using an adult bag. So they've even thought that far.
And even the reservoir.
And the reservoir. So they're doing the treatment correctly despite it being a simulation. So hats off to the simulation team, and then hats off to FDNY.
And I think, again, why the GEMS games is so unique and can't be found anywhere else is that there's so many teaching points in there that those crews come in, and the 600-700 people that watch it all learn from the same thing and go back and say, gee, why don't we do that? I remember with the metronomes and other things, people said, oh, that's a great idea. And I think that's one of the pluses. It's not just entertaining, it's not just educational, but it's instructive for the future.
In this particular case, an additional patient was introduced. It was a firefighter that came in close contact with a beehive, and that firefighter ends up having an anaphylactic reaction, goes unconscious, and despite whatever the paramedic does, in a very short period of time, the person is going to lose their pulse. And you see the firefighter actually getting up. That's because we've replaced them with a Laerdal mannequin. Laerdal off stage can now tell the mannequin, produce a pulse, don't produce a pulse, breathe, don't breathe, and actually have the paramedic assess and actually feel the vital signs.
And one of the nice things with Penwell is that we have our own video department, and they send 6-7 video teams, and we film this from all different angles. And then there's a switching controller in the back of the auditorium so that the audience can see up close. Just what you're seeing here now is up on the screen, and I think that's one of the good reasons to come to the GEMS games is that we've really put the resources and the finances into making this the top premier competitive event in the country.
One thing that we look at here is we're focusing on, for example, compressions. The entire year we've been focusing through articles and through interactions across the country at the Eagles. The different medical directors are stressing the importance of quality chest compressions. And so we actually try to evaluate across the spectrum which team does best, pressing on that chest, therefore moving blood through the heart.
And, and I think we've talked about this as judges and coordinators as well. People will sometimes say, well, this is paramedic level. Probably 90% of what goes on here, Chris, is basic life support.
I believe that a team, the more solid a team is with basic life support skills, I think the better they're going to do. If you just have a real sharp paramedic that comes in and does the few key critical advanced life support things, along with solid BLS, you're going to end at the end of the day with more points.
Yeah, and even in the young lady here who falls and has a nasty fracture, sometimes you get distracted by that. And the solid teams are those that know that they have to do a solid primary and secondary assessment and really take care of that patient. Because you can miss a sprung pelvis, you can miss some other kind of a fracture, and really it takes good BLS to make good ALS.
So what are we looking at with a fracture like you see there that's been moulage on this young woman? We want to see that the arm is assessed, that we're checking for circulation beyond the injury, that we cover the wound, we keep it clean, we keep those bone ends, there's no white blood cells there, so we want to keep the contamination down, we want to splint it, we want to calm her down. If we have some time or resources, maybe give her some pain med. We have to make sure her vital signs will support the pain med. So there's a lot can be done for this patient because she's a basic life support patient.
And you trust me that patient will not be neglected with Fran there, and that's his relative, because Fran is all over those teams to come in and take care of her. Hey, buddy, what are you doing? Come on, she's hurt.
Notice here you've got a feedback judge who is strictly there to observe and give the rescuer feedback. Fran went to get a rescuer saying, hey, get over here and take care of my patient. That is scripted in intentionally. We want Fran to be a distraction. Why? Because that's what happens at scenes.
At every scene.
So what we're also looking for is, do we get law enforcement or somebody in to help with crowd control?
Well, what I thought was incredible this year is we had some new technology from Furno, their new INX stretcher. And in years gone by, you'd bring a stretcher and you couldn't get very close to the stage. But what I noticed this year is the INX actually can raise high enough that it actually was over the lip of the stage, and they could actually bring that stretcher right on stage. Doesn't seem like a big deal, but it is a big deal. And they had their scene lights on it. It's an incredible piece of technology. And we give them a lot of extra equipment. Hartwell gives us some combi carriers. We have Laerdal backboards, and it's up to the team when they walk in. They don't know where the equipment's going to be. We always have a little stockpile area, and they can start to use it. And at certain moments, like the 13, 14, 17-minute moment, you have a transport, and then they have to make a decision which priority patient goes first.
Fran, the gentleman there on the right, we call him the father of the Fran clan. He is intentionally inserted in here at the 11-minute mark to cause distraction. He and his family are coming home. They find this because a helicopter has crashed into their neighborhood, and a relative of his, the one with the fractured arm, falls down amongst the debris, gets a compound fracture, an open fracture of the arm. And so this is intended drama, and Fran is outstanding of it.
Yeah, and it's not unusual at a scene for somebody to be a looky-loo and coming by the scene and crash into somebody else. And in this case, she runs up into the area and falls, trips and falls, and then, all of a sudden, the most important person to him is his relative, and he doesn't care what else is going on. He just wants to make sure that somebody's getting taken care of. And you can always see the crews take a deep breath when that distraction comes in. They know it's going to happen at some point, and all of a sudden, they just have to kind of manage that. Once again, here you got the baby who's now intubated, which is, really an added bonus in a competition like this to have a child who's intubated. But the most important thing is oxygenation, and that's where Laerdal comes in. Up on the screen, they're showing whether that patient's oxygenated well, or not oxygenated well. And the crews only can look at their monitors, but the audience can see everything that's going on as well.
That baby that right there that has the endotracheal tube in, the crew can also be deducted points if they don't manage the airway correctly. So if that tube gets displaced, we'll be able to tell that in the technology that Laerdal brings to this. So it's a double-edged sword. Yes, you want the points for the advanced airway, but you also want to make sure it stays in. Very, very tough to keep an endotracheal tube and a baby on a scene like this. You can see it's already leaning over and I would say marginally still patent.
And the teams have to have in their kit just about anything that could be needed at the scene. Of course, we have our cadre of drugs, but in this particular case, not everybody carries a splint. And having a rolled up SAM splint that could be improvised and used is a real plus, because you're not going to be able to run back out to your ambulance to get a rigid splint or a board splint.
As you see a gurney being brought in, this was not even allowed to be available to the crews till the 13-minute mark. So at 13 minutes, we're at the back of the auditorium, they walk forward. This is probably at about 14 minutes. It's the first time any transport capability is made available. This crew is a basic life support, although they've got training to do far more than they're allowed. They are told to do nothing but be the gurney drivers.
And I think for the audience, there's a couple of points to be made about that. First of all, it'd be real easy for us to have a bunch of stretchers and allow them to offload their quickest patients into an ambulance to another crew to get it taken care of. So we really want to work the crew. But the other thing is we think of our rural neighbors and the people that are in rural America that aren't going to have transport resources for quite a long time. And this really works the crew. What do you do if you're on a scene with 5 critical patients and you don't have transport available to you?
Absolutely. And you can see one paramedic is now picking up the equipment, taking it to a patient that they could not bring to the casualty collection point because there was a light pole that had fallen on them. This is now the 17-minute mark, so time is called, and a lead judge
let's just take a watch at him, because what he does is he writes things down. He knows as much as he can. He gets a very quick briefing from the other people, so he understands exactly what's going on. And then the thing that amazes me that personally I don't think I could do at this point, but I probably could have done 10 years ago, is to rattle off that assessment so quick and so crisp and so clear. I think this has become a paramount part of the JEMS games.
I think so, and they're given 1 minute to gather their thoughts, to gather their information from the other 2 crew members, and then they're going to be handed a microphone. And the scenario is you're going to be talking to your hospital when really they're just talking to the audience.
But look at the facial expressions. These team members don't know that there's 600 people in that audience. I mean, they know they're there, but they just don't have any sense of perspective of that, because their only worry is to do this.
All right, so patient number 1 was a approximately 35-year-old male, status pulse, looks like a helicopter accident. Positive respiratory burns, unconscious. Upon our arrival, we started to ventilate. Patient proceeded to cardiac arrest. Patient 2 was an anaphylactic shock secondary to a bee sting. I gave her 0.3 milligrams of epi-IM. Proceeded to stabilize the patient until transport arrived. Patient number 3 was a tension pneumothorax, unconscious, positive chest trauma on the left-hand side of the anterior part of the chest. I proceeded to give a 22 gauge Decompression to the second intercostal space over the third rib. Patient had an immediate egress of air, responded appropriately to the treatment. Patient number 4 was a stable right arm fracture to the left arm, right arm. My partner did an initial assessment on the patient. Then we proceeded to establish an IV to the left AC and gave 0.1 milligrams per kilogram of morphine, which ended up being 5 milligrams total. We stopped at the 5, patient proceeded to be sedated, and we ended the scenario with that.
That's a lot of them.
And the DOA.
And it is in one of the two key factors.
Time. Thank you.